Hello everyone, hope all of you are doing great. This paper is an investigation report or paper that focuses on vulnerabilities in Internet of Health of Things. Medical devices are getting smarter and more interconnected with each other, even with other smart devices. Not even though are standalone, but they have connectivity capacity with other devices, so the data transfer takes place between each other. Cyber attackers targets the vulnerabilities that exist within the devices. Compromised medical devices can change the way how the device operates, generate false readings from sensors, and results in life-threatening situations for patients. The weakness in technical and physical security controls of the device may be hardware or software related. All these devices are at risk of being hacked with unauthorized access and malware. There are a number of medical devices which monitors our patient's health situation from blood pressure, blood glucose level, temperature. All this helps to the medical practitioners to monitor a patient's health. Systems resources needed to be managed in such a way that it provides efficient and effective medical device to the end users and constantly upgrading in such a way that it can combat threats with the help of device manufacturers, resulting in a quality and safe environment for patients and users of the medical device. Organizations, especially healthcare providers at management level, should have strategies to tackle the issues of medical device security issues, because if they don't tackle those issues, it may result in life loss of a patient. In this paper, we provide a brief description of medical device in relation to different regulatory bodies through which we try to understand the need to make the medical device safe for the users. We explore the vulnerabilities of medical device, how they may be explained to infiltrate the full healthcare system and other devices in the network. The paper covers 3 recent incidents of medical device vulnerabilities and explores the concept of blockchain that may be used to limit the vulnerabilities and their limitations. Medical devices have a risk classification level associated with them, which allows regulatory bodies to scrutinize different medical devices differently and establish different level of controls. Regulatory bodies also consider cyber threats in consideration when providing approval and follow different standards based on country, region, risk levels such as ISO 14971, ISO 13485, IEC 62304, AME/UL 2800, etc. And these are not limited to different countries or origins. There are numerous standards which are laid across, and these provide guidelines for the regulatory bodies for the approval of medical devices that can be used in the region or in the country for against the origin of the medical device or the manufacturing country. At a glance, if we have a look at the cyber attack on healthcare industry in 2020, what happened? It was 6.6% of total cyber attacks among the top 10 industries if we consider. Healthcare industry is the 7th most targeted sector. 20% of all healthcare attacks were ransomware. Third most targeted with server access attack. So you can see it is very, very important that we take care of the healthcare industry so that individuals or patients can have a better life and secure life, and the industry survives from any potential cyber attacks. If we have a look at the following attacks, they are the mostly deadly ones to the healthcare ecosystem, and these are denial of service or therapy to patients. They directly alter the function of device and causing the patient harm. They result in loss of data and privacy of health data. Server access attacks on healthcare device networks, and ransomware on medical devices. There are few known cyber security vulnerabilities of medical devices that already exist, such as protection mechanism failure, hard-coded credentials, cross-site scripting, improper restriction communication channel to intended endpoints, meltdown spectre, vulnerable third-party software, search path element uncontrolled, path traversal, unquoted search path element, etc., etc., and the list goes on and on. Vulnerability exposure of medical devices comes from information on technical specification, legacy system and software, patch and software updates that hasn't been updated as per recommended. Some of the medical device have some basic security features. Some of the medical device has web service interface. When the medical devices are connected in network, if the network is compromised, any device in the network is compromised, that device can lead a gateway to the medical device that is not yet compromised. There should be a balance of safety and security, but that point is also a vulnerability exposure sequence, because sometimes if we think of doctors or nurses or any medical practitioner, maybe they have 3 or 4 layers of security to access an equipment, but when patient diagnosis takes place or when recommended practice that needs to be taken by general practitioner is immediate, then there needs to be a borderline between which is come first, health of a patient or security of the device. Many of the devices has limited energy use capacity, because if it is a wearable medical device, they are not powered with very powerful energy source. The motivation to exploit that medical devices and carry out an attack by an attacker influenced by financial gain, state or national interests, sparking cyber terrorism, extract performance data of a device for corporate espionage, etc., etc. Out of all motivation factor, money is the biggest motivator. The devices on hospitals and other facilities has lot of information, including sensitive personal information, which attracts lot of attacker to extract the data and sell to potential buyers. The recent incident that we exploit are the three recent incidents. Swine tooth vulnerability is a collection of 12 vulnerabilities and possible of more to be identified and released. It affects 7 different Bluetooth low energy sock manufacturers utilizing different modes of software development kit. Medical devices from following BLE sock manufacturer is said to be affected. The stated vulnerability allows an attacker to trigger deadlocks, buffer overflows, crashes, or completely bypass the security from radio range, thus compromising the medical device. GE Healthcare clinical information, central station, and telemetry server are exposed to vulnerabilities from using a specific software version. These medical devices are used to monitor psychological parameters of a patient, physiological parameters of patient, example, blood pressure, temperature, etc. The vulnerabilities allows the attacker to take control of medical devices and silence the alarm, generate false alarm, and the interference with patients' monitors connected to these devices. Argent 11 is a collection of 11 identified vulnerabilities in IPNet, a third-party software component that supports network communication between computers. There are many medical devices may be affected by the use of software, includes infusion pump, imaging system, anesthesia machines, and more to be identified. The vulnerability allow attacker to take control of medical devices, change function, causes denial of service, which may lead to the information leaks or logical flaws and prevent device function. Solutions trends for healthcare device cyber attacks considering blockchain. If we consider blockchain, a solution for those devices in blockchain, transaction is done via public and private keys, where private keys act as security barrier for user authentication. Since the processing takes place at separate blocks, it is independent of central server or database. Each node or decentralized block can perform the required task on its own. Ethereum-based contribution. It proposes to implement smart contract for devices users request based on credentials on the domain. The authors proposes proof medical stack to higher security against malicious attacks. Modified consensus protocol. The proposed system is a consortium-based blockchain architecture where a patient agent software defines the blockchain functionalities. The computing is done on edge computing network and data is stored in cloud-based server in secure storage. Modified cryptographic technique. The proposal uses two software systems integrated to original blockchain algorithm for data encryption, ARX algorithm, and Diffie-Hellman key exchange technique for transferring public keys. The nodes must be certified before joining a blockchain and stores interconnected block with high data in cloud server with higher security. Cluster head is used to verify and store hash blocks in cloud server and manages interaction between the clusters. Hyperledger based contributions. The authors divide the blockchain in two segments: medical device blockchain to store data that were generated medical device during treatment, consultation blockchain that store patient's record and data is maintained by health care provider. The transactions are verified by smart contracts and execution is endorsed by practical Byzantine fault tolerance algorithm. General blockchain concept without technical specification. The data is stored in shared between tamper-proof blocks between IoT device and healthcare providers. MetChain proposes grouping the data generated between sensors, blockchain network that stores immutable data, and P2P network stores mutable data, mainly focused on data query. MetChain uses BFT smart protocol. Though it is a proposed solution, there are some constraints. to use blockchain on IOHT. Processing the internal processes of blockchain requires lots of resources for computation, thus also requires high energy, which is already a problem of medical device, especially in cost of energy use, more relevantly for wearable device. Storage. The medical device produces large amount of data, but not to store them in different blocks, and interacting through different nodes requires even larger space. The large space usually cannot be accommodated in IoT device. Real time. In healthcare industry, it is very valuable to make decision. Since blockchain involves connectivity between different blocks and nodes, the computation time is increased, resulting loss of time for potential patient care. Traffic overhead. The inner interconnectivity of blockchain creates lots of traffic for data flow. This feature cannot be easily adopted by IoT devices with limited bandwidth. Though there are constraints, but blockchain can be a useful solution for patient data security. At the end, we can say medical devices are the key to well-being of human life. They must be protected from a cyber threat so that patient can take required health support from healthcare providers. The medical device regulatory bodies should come together with the device manufacturers to formulate standards that are universally adopted and addresses ever-changing technological environment. There exist limitations of technology, medical device compatibility, which make them more vulnerable to security attacks. But the new processes, innovation, algorithms are also being developed to address these issues. This paper briefly outlined vulnerabilities by keeping the focus on medical device only, but there are other areas of healthcare system that is not discussed. A further research scope on blockchain combined with edge computing may provide more secure and fast reliable solution to IoT devices that is sought after. Thank you for your time. Hopefully you will go through the paper and better understand what is explained in the paper and the approach towards better and secure healthcare devices. Thank you again. Thank you.